Season and many people are dealing with a stuffy nose and sinus headaches. Well, now there is a new treatment to help. And with us this morning, we have Dr. Madan Kandula here to explain. Good morning and thanks for coming.
Good morning. Thanks for having me.
So he's here to talk to us about the different procedures and talk to us about why this procedure is kind of different than surgery and how it works.
Right. So basically, for folks who have sinus infection issues or headache issues, those sorts of things, the big issue is that the sinuses aren't draining properly into the nose. And so what our traditional techniques we had to go in and remove some of that blocking tissue to open things up. With the newer techniques, we're able to go in and use a balloon to expand the natural sinus passageway. So it makes it a lot more efficient, effective, more elegant.
Right. And who could benefit from this, and how can you tell if this is what you're dealing with?
Well, for folks who are getting lots of sinus infections, or have a sinus infection that doesn't go away, folks who have kind of chronic headaches that change with the weather patterns, or chronic stuffiness, any of those folks could potentially benefit from this.
We're kind of looking at a little video right now of maybe how this kind of works. This is interesting.
Yeah, no, it's pretty cool. So this is just showing an animation of what this looks like. This is in the nose. It's kind of hard to orient, but that's the balloon that we're putting up into the sinus opening. It's an angioplasty type balloon, so we're just inflating that, and what it does is it pushes the sinus opening open. So instead of removing tissue to open things up, we're able to get in there, find the natural sinus passageway, open it up, deflate the balloon, it comes out, we don't leave anything in, and now we've got a sinus opening that's open. So that can drain properly, the headaches can be minimized, the infections can be minimized. So it works, very, very nicely. It's been a game changer for what we do.
Right now, do all doctors have this technology, or where can people go for this?
No, I mean, there are some folks who do have it. I guess the biggest change that's happened over the last couple of years is you can do this in the office. We can do this in the office, kind of like going to the dentist's office, getting a filling done. We get things numbed up, we can get it done. You go home the same day, you're back to work the next day. Pretty slick in the grand scheme of things, and effective.
Right. And speaking of effective and effects, actually, what about side effects and recovery? How does that work?
Pretty minimal. Anytime we do anything in the nose, we're going to create a little bit of stuffiness, so just like you have a cold. Otherwise, pretty minimal. You can blow your nose, you can do what you normally do, you can exercise. There's really not any particular downtime. There's a recovery phase. It's not everything's 100% successful, but it's remarkable how many folks can benefit.
Wonderful. Thank you so much for telling us about this. Just one more time, where folks can get more information about how to get this done and where?
You can contact our office. Advent.md is our website, or just give us a call.
All right. Wonderful. Thanks so much. And of course, we have that on our website, fox6now.com. And we'll be right back.